Hello, my name is Emily Jordan, and this is my PowerPoint on traumatic brain injuries, also known as TBIs. So what is a TBI? A traumatic brain injury, also known as a craniocerebral trauma, is a brain dysfunction that is usually caused by an external force to the head. This can be caused by a car accident or even a sports injury. The effect of the blow may be short-term or long-term, depending on the severity of the trauma. However, if it has caused enough damage, it can result in death. The effects can appear instantly or can be felt days or weeks after the occurrence, which makes it especially dangerous. Some of the major parts of the brain include the cerebellum. This location is at the base of the skull behind the top part of the brain stem and is made up of two hemispheres or halves. The function of the cerebellum receives information from the sensory systems in order to regulate motor movements such as posture, balance, coordination, and speech. When there is damage to the cerebellum, it will cause a lack of balance, slower movement, and tremors or shaking. Next is the frontal lobe. The location is in the front part of the brain, which is right below the base of the forehead. The opposite part of the frontal lobe has the right hemisphere controlling the left side of the body, while the left hemisphere is controlling the right side of the body. The function of the frontal lobe is where they control the important cognitive skills such as the emotional expressions, problem solving, memory, language, judgment, and sexual behaviors. The frontal lobe is the most common part in the brain to get injured because of blows to the face, such as in car accidents. It can cause changes in personality, limited facial expressions, difficulty in assessing one's environment. Examples are assessing risk and danger. Next is the occipital lobe. The location of the occipital lobe is in the rear portion of the brain behind the temporal and the parietal lobe. The function is responsible for visual communication. It is in two parts, which is the visual receiving area and the visual association area. One area of the occipital lobe that is known as the primary visual cortex, which receives the information from the retina, such as color, and interprets it. If the occipital lobe was to get damaged, then there would be visual impairments and other visual related problems such with the possibility of blindness. Next is the parietal lobe. The location of the parietal lobe is near the center of the brain behind the frontal lobe, in front of the occipital lobe, and above the temporal lobe. The function of the parietal lobe contains an area known as the primary sensory area. This is where impulses from the skin are interpreted, such as touch. Similar to the sensory area in the frontal lobe, the more input received from an area of the body, such as the fingers or your toes, the more surface area of the parietal lobe used in the head. So, for instance, the more touch you have in your fingers, the more surface area is used to interpret that touch. The parietal lobe is also important in spatial information. If there is damage to the left side of this area, it can cause right-left confusion, agraphia, which is difficulty writing, acalcula, which is a difficulty with math, aphasia, which is language disorders, agnosia, which is the inability to perceive objects normally, and all that together is known as Gertzmann's syndrome. Meanwhile, damage to the right portion can cause contralateral neglect, which is the neglect of part of the body or space, which makes it difficult for self-care, such as dressing yourself and washing yourself. There is also constructual apraxia, which is making things, or agnosagnosia, denial of deficits, and a loss of the drawing ability. There is also a bilateral damage, which can cause ocular apraxia, which is the inability to voluntarily control gaze, or there is also simultaneoagnosia, which is the inability to integrate components of a visual scene, or optic ataxia, which is inability to accurately reach for an object using your vision. And With the bilateral damage, it is known as balance syndrome. Next, we have the brainstem. The location is in the front of the cerebellum and connects to the spinal cord. It is made up of three major parts: the midbrain, which controls eye movement and process visual and auditory information; the pons, which is a group of nerves that helps connect different parts of the brain. It also contains the start of some of the nerves that control facial movements and transmitting sensory information. The pons is also the largest part. Then there's the medulla oblongata, which is the lowest part. It acts as the control center for your heart and your lungs, and it helps regulate many important functions such as breathing, sneezing, and swallowing. If there is damage to the area, breathing and heartbeat can be ceased, which would result in death. If the brainstem gets compressed, there could be hemorrhaging and a stroke, which will result in speech impairment, breathing difficulties, sleep apnea, difficulty swallowing. In some cases, there can be personality change, memory loss, or if it's a really severe case, there can be a loss of consciousness, coma, and paralysis. Now, there's the temporal lobe. The temporal lobe is on either side of the head, level with your ears. The function will coordinate specific functions such as visual memory, verbal memory, and understanding emotions and reactions of other people. The visual memory is facial recognition, and the verbal memory is understanding language. If there is damage here, there can be a disturbance of auditory sensation and perception, disturbance of selective attention of auditory and visual input, disorder of visual perception, impaired organization of and categorization of verbal material, disturbance of language and language comprehension, impaired long-term memory, altered personality and affective behavior, and altered sexual behavior. Now, what to do as a teacher for a student that has a TBI? Some accommodations that we can use as teachers is to have a student sit close enough to the teacher to avoid all other distractions. Minimize the amount of distractions within a room, meaning less posters, try and minimize the talking amongst other students, and try to make it visually minimalistic. With the use of a tape recorder, the child can record the notes so they can listen back and won't forget some of the information. When giving the child an assignment, you should provide it in writing so that they have it in front of them that they can read over multiple times if needed, especially at home. The use of a daily organizer can improve and help the memory of a child so they know what they must do outside of the classroom. And lastly, you can break a project into steps so that the child can focus more on different parts instead of trying to focus on the project as a whole, which will center the focus a bit more.